What up?
What's up?
It's working.
Yeah, crystal clear.
I think this is the first time too. It's like perfect. I'm connected to my
It's
Wi-Fi.
nice. It's nice. Let's see. Cool. I'm gonna take a 2 second bathroom break and then we'll rock it. Just
Perfect.
let a few more people get on.
And if you're watching right now, guys, but you guys can actually, there's a little question box, like a little actual like question mark that you'll see right here at the bottom of the screen. And if you have questions related to hormonal birth control or questions in general that you want me and Austin to go over today, just click that little button and you can drop your question in there and then we can see it as we're going through. So it's a good way to not have your questions go missing as we're actually like looking through everything today. Hi, Whitney. Hi, Sonia. Hi, Maddie. Hi, Kelsey. Awesome. Yep. So if you guys drop them in there, or if you guys message them right now, like whoever just messaged me won't be able to really open those back up. Hey, Marina. But Marina, I did get your question. So I got you. You're locked and loaded. Carly, I got your question. And Mallory, dope.
Did you already answer all the questions?
Yeah, we're done. Thanks. So
We're done. Okay, thanks. Thanks for coming.
yeah, thank you everybody. It's been great.
Appreciate it.
No, I was just letting them, whoever, like the couple of people that are, I have their questions and that they can drop questions in this little like question box because it's kind of like a thing that a lot of people, how about this?
Yeah.
I didn't know that. Just watched your live, like not last week, but the week before.
Yeah, I just learned about it. So
Amazing. Amazing.
sweet. Sweet. Cool. Did you let everyone know what we were doing?
You mean with the live about hormonal birth control?
Yes, you did announce what we were saying, what we were talking about on here.
Yeah. Yeah.
Okay, cool. Well, we did
Obviously,
get a question.
other questions too, like outside of that, like, or like hormones in general, like you can ask kind of whatever questions. We're just trying to keep that topic.
Okay. We did get a question already, so
Cool.
let's rock and roll.
Let's do that one off these other ones.
You want to do this one first?
Yeah.
Okay. So they asked about SHBG. They said SHBG over double the normal amount on BC pills. Any way to reduce this without getting off BC? And what are the disadvantages of having it high? We've talked about this before.
Yeah.
Yeah. So go ahead.
Yeah, it's how about this? I feel like it's almost an anomaly when it's low when somebody's on birth control.
Yes.
Most of the time, almost double when they're on hormonal contraceptives. And Austin, if you want to jump in too, but most of the time it depends on like what a person kind of already had going on. And some of it ties into like their adrenal function as well and what the body actually like needs to create. So if the body thinks it's there, or if it thinks it's not there, it's going to kind of depend on what it binds to. Like what does it the body think it needs and what does it actually need? And it'll turn on the messengers or turn them down. Austin, right. I don't know if you add into that.
Yeah, just for maybe those that aren't listening, they realize like SHBG is sex hormone binding globulin. So like it's literally, well, some people might not know that. It's literally binding to those sex hormones. In this case, probably mostly an estrogen binding issue, depending on what kind of birth control. We see a lot of estrogen dominance with hormonal birth control. So most people think that the SHBG is binding to only testosterone. That's not really the case. So if we have an excess, then it's basically like, hey, we don't need all this. Let's bind it up so we can't use it type of thing. Another thing to remember is we have binding hormones for all kinds of stuff. We have thyroid binding globulin. We have cortisol binding. We have sex hormone binding. So these things are normal. It actually just means that there's probably too much of something. and the body's trying to essentially like deactivate it.
Yeah, like
She
auto-reg.
Right. So she asked if you can fix it without coming off birth control. That's a question. Answer's like probably not. I mean, really no, because I mean, if there's an excess of something, the only other thing I would say like is if you have some kind of other like underlying gut issue or something that might be causing even more additional recirculation of estrogen, then maybe.
Yeah, I
Right.
would say looking at labs, you're gonna know if you have other like if there's something that stands out, maybe your estrogen's at 300 and your liver's clogged. Like I would say definitely lowering that and opening up detoxification pathways and working on methylation, like it could come down, but
Some.
it's like times of boron is going to counteract your Mirena.
No, no, I know. Like, hey, I'm taking 12 milligrams of boron. I'm like, good luck.
Yeah,
So
yeah.
I was like, I don't think that's going to do it.
That's common when you see that in lab. It's easy if you have these like ideals of like 60 to 100 that my levels should be at, but if you're seeing 200 on labs, like that's absolutely not abnormal for hormonal birth control in general.
Yeah. Okay. Good. Yep. Um, this one's not BC related, but resources to begin studying more about gut health.
Austin's gut health course. No.
Yeah. Yeah. Well, I have no joke. Like seriously, my gut health course covers that's about as much as you're ever going to get in a couple hours, I think, and protocol stuff. But, you know, any of the podcasts, like any podcast that I've talked about it, any podcast Sonia's talked about it, anything on my YouTube channel, there's a whole bunch of shit on there.
A really good
All that
base.
stuff. Yeah.
I'm a newer coach. NCI, National Coaching Institute, they have like foundations to gut health course that Travis Zipper did, who was a mentor of mine for a long time. And it's pretty good. It's very basic as far as like, this is because I think that people want to jump ahead to like what protocol to use. But if you don't understand that, like, it's not about the digestive enzymes you take, it's about chewing your food, and you don't really understand like the very basics of eating all the way through those things, it doesn't really matter what supplements you know. So if you're looking for like a very basic, how do I start kind of learning about digestion, that's also a really good one that takes you through basically like what you would then come into protocols. Like, okay, well now I need to start learning about like antimicrobials and how to read a GI map. It's a very like foundation like course, you know?
Yep. Yeah. Yeah. That's a good point. I mean, a lot of people are kind of get way ahead of themselves now because there's so much stuff out there.
Everyone has SIBO, you know?
Yeah. I know. I farted earlier today. I'm pretty sure I have SIBO.
Yeah, soft stool, like these changes.
Yeah.
Like some days you're gonna poop and it's awesome, and some days you're gonna poop and it's not gonna be as awesome. Like, or it'll be like nuggets, or it'll be really soft, and some of that's just like there's so many factors. And when it comes to women specifically with hormones, forget about it.
Yeah. Someone asked, been off birth control for 10 days now, following the protocol, currently flushing. Everything has been great so far. How long does it take to see side effects, if any?
Okay, so your first 10 days is always kind of what feels like a cakewalk.
Yeah.
Like it depends is a statement, but when did you stop your hormonal birth control? Were you on, like, I guess, I don't know whoever asked this, were you on the pill or IUD? Were you in a bleed week? Because normally the first period is when you're going to start to see, or like the first time you're going into that luteal phase is when you're going to start to see everything and feel everything tenfold, typically from what I've seen.
Yeah, and sometimes some of it's kind of like, hey, I haven't had a cycle in so long, I don't really remember. Or shit, I've never had a cycle since I was like 15 years old. It's like, you know, some of the times it's literally just normal PMS stuff that you're kind of supposed to have, you know? So, and if anything, when I see somebody, that you're supposed to have, I've not had it, but you know, if anything, when I see someone that comes off and then they start PMSing, I'm like, oh, cool, we're getting a response. You know what I mean? Like we're getting some type of like luteal phase and progesterone going on. So, but to answer the question, like, who knows, really? I would.
very different, but it seems like 3 or 4 periods, not like
Yeah.
3 or 4 actual periods. Typically things start to dissipate a little bit as far as like symptoms go, and we have some sort of regularity happening. For me with my clients, and I'm sure with you too, like not just like a flush phase while they're coming off. I prep, and it's like that lifestyle and all those things that come after. First, we're preparing the body, and once it's actually out of the body, we still have to work on basically like, let's just say like each period that's been stored up while you were using hormonal birth control and all the things that were going on in your life during that time. So if you were inflamed, dealing with gut issues, if you were dealing with a lot of stress, you'll start to see those in your cycles as well.
Yep. Agreed. Okay. This one, not birth control. Well, hormones, I guess. How would you supplement for low iron, low ferritin, and low progesterone?
Wow.
And they ask, are low iron / ferritin and progesterone related to each other?
So I have seen this in PCOS where we have low ferritin and iron kind of like in 2 or 3, but I don't know. I'm gonna refer this to you.
Well, first thing, like obvious one would be like dietary, just make sure that you're getting enough iron. In
Yeah.
women especially, it's not uncommon to have iron deficiency via diet because you just don't eat as much protein as men. Women seem to not like meat and things as much as men, like it just, if I'm making a general statement. So, I mean, always just check and see how much you're getting in. What other issues might you have that would cause like malabsorption in, in iron or nutrients in general? Like, do you have any type of gut issues? Because that would definitely play a factor. So think about that. Are you getting vitamin C in your diet? Because that plays into iron absorption a lot. Like I literally had a guy, this is a guy, but I'll give you an example. His ferritin was really high, so he was storing iron, and his iron levels were relatively high. And he was actually eating a lot of fruit in his diet, like really high vitamin C intake. And we kind of like swapped a little bit of that out for a little more vegetable and a little more starchy carb. And his iron plummeted down to normal level. He was getting so much fucking vitamin C in his diet. So, like there's little things that could adjust it, that could change it.
Supplements, everyone, and like the airborne and like I think there's like this massive amounts of all this like immune support with like corona, and so you can also over supplement some of these things like zinc and vitamin C in your airborne packs and Spark and all this like stuff that immune system. There's a fine line on that too.
Yeah, for sure. So just check it. They asked about, I mean, you can supplement for iron, but honestly, it's not too difficult to get some iron through the diet if depending on what your diet is like. Low progesterone, 0.22, literally like the progesterone that we see in every single person, pretty much. Like everyone, it's funny. Like you get a client and if they're not used to this type of thing, like, oh my gosh, my progesterone's a 0.1. I'm like, honey, every progesterone's like a 0.1. they're all a 0.1.
And I was shocked. Her progesterone was 14. I was like, wow, this is like, I rarely see this on labs. And we were on day 19 of her cycle. I was like, this is like
So I had a girl recently that post contest, this is a testament to her. She took 3 or 4 years off between shows and had like this perfect, like immaculate off season. She competed and did really well, won her class, blah, blah, blah. Back in the off season, 2 months in, her progesterone was a 19 post show. And I'm like, damn.
Yeah. That's nice.
I'm like, damn. But no, other basic things there would be obviously stress cortisol issue that's stealing progesterone. If that's present, it doesn't matter how much chaseberry you take, like it's probably still going to be a problem. Chaseberry will help.
Yeah.
Signal LH.
Yeah. Vitex is another like really good one. It kind of, like Austin says, like there's 1,000 reasons why your progesterone could be low. It's just about kind of connecting the dots of like why specifically what 1 or 2 reasons yours might be low would be. And making labs for drawn time. because I don't think everyone always does that. And then you'll listen to a podcast and then they'll throw out these numbers and it's going to be different for everyone.
You can, and if you're really, if you're really wondering about the labs and stuff, you can always do a basal body temperature and try to find out if you're ovulating. Just check it. There's a bunch of apps, there's a bunch of info online. You'll see a small rise in temperature. All that information's out there. Just, you can check it. If you're like, I'm not sure if I did my labs at the right time, give it a shot. It's free. It's easy,
Yeah.
So
prevention too. I mean, like, it's a very effective method. You can see the body will rise as progesterone goes up, the body will rise. You can see ovulation, and the more consistency that you have with these apps, the more they're able to really give you like a very strong phase of like these specific 4 to 5 days would be your like not optimal to be either trying to conceive moments or not optimal to be sexually active.
Perfect. Yep. They ask anything in anything in morphodite, chasteberry, L-car, fenugreek, or DHEA that would raise heart rate. No, not off the top of my head, but they did ask, or alternatively, could that have anything to do with hormones coming up? Yes.
Yes. All of those things will bring up hormones.
Yeah.
All of those things are great for testosterone, natural, especially like in women. Those are all great things.
Yeah. I would expect with chasteberry, fenugreek, DHEA, all those things that you would see a rise in hormones like that, and morphodite too, because that has a few ingredients. But for sure. So if your hormones are coming up, then yeah. But they asked about heart rate. I don't really know other than adrenal function increasing.
Yeah, like if you have a low heart rate, like, or if your heart rate's low blood pressure, light sensitivity, and you're dealing with adrenal issues and you start supporting with DHEA, it's very likely that your heart rate will come up, but none of those are going to cause any sort of like tachycardia issues.
No.
And in heart rate in that way.
No, because you get people that you see, like, lower heart rate is generally a good sign of lower stress, but to a point. Like if they're seeing heart rates like 45 and shit like that, and like, all right, this is a bit low. Yeah. Let's see. Okay, somebody I think asked a question in the actual, they're talking in the little comments, which is a little bit harder to see, but not everyone's in it with the question box. Type your question in the little question mark circle, and it won't get skipped. Yes, that is correct. Here we go. Client coming off HPC after 17 plus years. Her ferritin was 250. Any correlation? Well, what do we think what is like abnormally high ferritin generally with these types of cases? It's normally iron hoarding. It's inflammation.
And yeah,
I sent you that article, I think, that we went over a while ago.
Yeah. I would say looking at their lifestyle in general, is this person drinking a lot, not sleeping, dealing with a lot of inflammation in general? What is I would look at their like cholesterol in relation to that as well, since that can also be an indication of inflammation inside of the body. I think that, I don't know, it's a little bit general of just like kind of to say one thing is like what exactly would be there without knowing more for me.
Right. Yeah. I just normally when I see, I would want to know for sure, like, are they just coming off birth control or is anything else going on with them type of thing. Right. But a really high, like when you have a really big discrepancy between like ferritin and iron, like a really high ferritin where iron's pretty normal, then that can be an inflammatory response. You just hoard that iron. So the person asking would be able to answer that better than us, because like this person have gut issues or stress issues or anything.
C-reactive protein and high sensitivity.
Yeah.
There's inflammation inside of the body, so you can look at those correlations.
Yeah, I would definitely look for inflammation. Also, like liver, like any liver function, look like ALP, all that jazz is going to be useful.
Normally you'll see, when you see one, you see multiple in these situations, especially when it comes to inflammation of the body, because it manifests in so many different ways that you'll normally see other things flags. I don't know if they hit us back. My thing is like frozen. I can't see, just the people who first joined who were saying hello.
Oh, no, I'm just scrolling. She said thank you, and she said sorry I effed up the question box. No,
Um, and I
no,
have,
no excuses. Apologies not accepted.
yeah, yeah.
You're
No,
all right. Yeah, you have some. Go for it.
okay. Preventing pregnancy without hormonal birth control or sticking copper in my hoo-ha. That's from Mallory.
So she's asking like what her options are,
Yeah,
essentially. Sticking copper.
in my,
Well, you alluded to one of the options with BBT, not
yeah,
BBC, not to be mistaken for BBC, BBT.
yeah, basal body temperature. That is, I think, I would say like that's the heavy hitter in the options. For most people, it's very easy because you can just take it in the morning and versus like you need to put in a diaphragm or you're using gels or there's other, I was like the pull-up method. Like there's other options. If you're with a partner that you've been with and you guys are like not really looking to have kids, obviously vasectomies are an option. They are reversible. There's a new gel, like I don't know much about it. I've just seen like 2 articles on it, but it's basically for men and it like prevents the sperm from coming down. It's like one
Yeah.
shot. Do you know what I'm talking about?
Yeah, I'm trying to think of what the hell it's called. It's like it's
The
basically like a super duper spermicide kind of
Yeah,
thing. Yeah. Which the only thing that worries me about some of that is like irritation sometimes, like from some of those things.
yeah. There's
So
IUT, like you'll see like the side effects, and there's a lot of like pelvic inflammation and urinary tract infections and things that can come with that as well, which can also come with having low hormones in birth control. Like there's correlations, like everything's gonna kind of have something, except for taking your temperature every morning is pretty easy to do and it's very inexpensive.
yeah. So
um
the only other one is the copper IUD. You can mention that. It does, yeah. I mean, it's going to have the obvious downsides of an IUD, which the insertion part, some people get pain, some people get discomfort, blah,
yeah,
blah, blah. That's with any IUD. You can have
yeah,
that potential. The only other thing I've seen with copper IUD, and this could be purely coincidental, I don't know. I did have a woman, probably about a year ago that had pretty bad copper toxicity that had a copper IUD. Now, I'm going to say that it's the only one that I've seen. And it is, from what I've been told by a physician that I trust, that it's extremely rare. So,
yeah. I've
um,
do more with like when a person has a zinc deficiency, they're more
right.
likely to have copper toxicity
Yep.
issues. And something very simple on your labs, like alkaline phosphatase, could be a good indicator if you have zinc deficiency, or
Yep.
if you have acid, just kind of like these things that are intertwined, to either be supplementing during that time, even if it's a lower dose, if you're going to be using the Paragard, which is the copper, um, that's an option as well. But yeah, I
Yeah.
think copper toxicity, pain, shifting, heavier periods also with those. And it, like there are still some people that have issues with those, even though
Yeah.
they're like non-hormonal. So
Yeah. Yeah. I mean, there's nothing, yeah, it's not perfect. It's just like anything else. Yeah. I would say like if you absolutely wanted something that was completely like hands off that you didn't have to think about, I would much rather somebody take a little bit of zinc and potentially do a heavy metal detox every 6 months than take hormonal birth control like all day long. If they had to do a copper IUD, like listen, there's nothing good that comes from hormonal birth control. You haven't noticed the theme. But no, basal body temperature works good, guys. Yeah, I would be like you said, vasectomies. Like you'd be surprised how many people like don't want children, but then like why? You realize this is like an inexpensive surgery and it's very quick.
And even if it's really funny, I think it's Jeff Black who calls them little fuck trophies. He's like, I've already got 2 fuck trophies. Like, but really, it's like you have to kind of have that conversation. If you're older, like, and you're not sure if you want to have kids, and maybe it's just like not the right time in your career, and you're dating somebody who's okay with it. Vasectomies do have a really good reversal rate as well. So it's kind of like even just having that conversation with your significant other, you would be surprised how, I mean, like, I don't know, like if, well, I guess it's kind of different because I have a kid right now, right? So it's hard to like speak into what other people are going through. But if I was somebody who was dealing with a lot of hormonal issues, which I have, and I am, like, I've been there, done there, got the t-shirt and the tank top and the hat. I think like putting your body at risk for more issues down the line is like, if your partner's like, I'm willing to do this and it doesn't change anything, then it has very little effect on the men, with the exception of like, it's a little bit more like versus like more than that, you know? It just,
Yeah, yeah, that's more of like a pregnancy risk conversation, but that is a good conversation. Like I do get these women, they've been through this ringer, they've been 2 decades of birth control, they've done this whole thing, then they're like, and they're struggling and they can trying to recover, and they're like, well, I want to have kids. I'm like, okay, I'm not a fertility doctor, and I am not, and ethically, like I'm never going to tell you what to do,
yeah.
but just keep in mind risk, these risks are exponentially higher for miscarriages, or heaven forbid, like something bad happening, or people that have had like 3, 4, 5 miscarriages and then they just keep, and it's like, okay, you know.
It's hard. And that's the biggest thing, I think, when we're talking about progesterone is this main hormone that really gets destroyed. It seems like estrogen is so much more resilient
Oh
than
yeah.
progesterone's what's needed for that baby to make it and to survive, and for the uterus to be healthy. And there's so many, like, when we look at miscarriages, there's many different reasons, but low progesterone in women is a leading cause of pregnancy, or high risk for miscarriage. And so if you're somebody who's already struggling with that, going into a situation again where you're specifically pressing that and then adding in that has and kind of turning off your body's signal, again, you're playing with more fertility issues down the line than just saying, I'm going to not go back on this. I'm going to restore this, maybe work with a partner who's getting a vasectomy or something like that, or freezing. Yeah. So
yeah, which we know how easily progesterone can drop just based on like stress. So you think if you've already someone that's pretty susceptible to this and they've had this in their history, then it just as well as I do. Like some of these people, they can recover. They recover from birth control. They recover from these issues, but they're always kind of like walking that tightrope because they never, like, if they kind of fuck up, then they can go back to shitty progesterone pretty quick, And so that's where we even get into like, hormone replacement conversations with people. It's like, we can kind of get you okay, but can we sustain this without, because nobody's perfect. Like this like bubble that we create for recovery and functional health, we realize that not every person can live in this bubble all the time,
life will be,
So
and unfortunately your body's response to stress is, it's going to do, it's kind of like, it's like relapse in general, right? You kind of pick up where you left off, and your body tends to want to go back there a lot easier, especially if you've spent 15 years on hormonal birth control and you've been off for a year.
check this one out.
Yeah.
She says, yes, exclamation point. I had 2 miscarriages. The next pregnancy, I supplemented with progesterone, and now I have a healthy 4-month-old. Badass. Congrats. That's sweet. So obviously, whoever her doctor was knew what the heck was going on.
Which is funny because that's the first time I've heard that, and I've had clients who come to me like with fertility stuff that we've worked through, like heavy metal toxins, getting hormones on track again, and no doctor seems to kind of like, even, how about this, test progesterone levels. I have a client,
No.
and her doctor didn't test. All they tested was FSH and LH, and I was like, that is like, what are we even looking at? We're just seeing if ovulation's happening. We're not even checking
Right.
the other side of anything. So
Yeah, you could have plenty of LH and not have jack shit of progesterone.
yeah,
Yeah.
yeah. That just
Um,
means that your pituitary is talking to your gonads.
right. Doesn't mean anything's coming out. They're just talking.
Yeah.
It's like they're knocking on the door, but nobody's there.
Yeah.
It's like, nope, nope, nobody's home.
Yeah.
Nobody asked this, but I thought it might be worth just mentioning was,
Nobody at all.
yeah, yeah, was androgenic, like androgenic repercussions of some of the birth controls. So, the only reasons, because I don't think people talk about this as much. I really don't think people know this, to be completely honest, that some birth controls are androgenic. So you can see hyperandrogenism symptoms, see it on labs while on birth controls. It seems like heavier progestin birth controls are the worst at this. And progestin only birth controls are
Yeah.
bad.
Molecule androgenic when you like look at it and kind of like, how about this? It looks more androgenic than estrogenic.
Yep. Yep.
And yeah, it seems to have a higher, so progestin base is going to be like Mirena, Kylena, Skyla. There's other ones too.
The generics, like the generics of those and stuff too.
Yeah. And you'll see an androgenic rebound, and typically people will be like, oh, like it can be like PCOS type symptoms, right? Where it's like you're breaking out and you're growing hair a little bit more, and you're kind of like dealing with a little bit.
You got this. You got a little like 5 o'clock shadow going on.
Yeah. And it doesn't necessarily feel great. It feels, and you hold more water, like that's estrogen. There's just kind of like this rebound that happens, and it seems like, one thing I like to use with clients and you too is like saw palmetto is a really good one to use coming off of birth control, especially when I see somebody who's coming from a progesterone based, and I see maybe testosterone levels or free test even like higher on those labs. I'll always add that in there as we're coming off, just as a preventative maintenance.
Yeah, for sure. I thought that was worth adding because I saw this. I had a lab like this literally like 3 or 4 days ago, so it was fresh in my mind. We had very like androgenic type of environment. It looked like, even though they did not have PCOS, they did not have any of these things. So it was a progestin. Someone also says, "Yep, that's what they gave me when I asked for a fucking panel. They must have gave her LH and not progesterone."
Oh, with fertility?
Yeah.
Oh, I know it. It's mind blowing to me. It blows my mind. It blows my mind every single time.
It's like a side note. There's a nurse practitioner and her husband's a doctor, and they live close to us, and we knew him from like our old gym we used to go to and all this. But long story short, I ask her questions sometimes about like insurance and like just different things, like why the fuck is this so shitty sometimes? Like why do they just not order these things? Like, why don't they order like free T3 for us and shit? And like, just anyhow. A lot of it's what we suspect is that they just aren't taught that way.
Yeah.
That's just not that's just not how they're taught. And secondly is a lot of it's kind of like an insurance thing too. Insurance won't like cover certain labs unless you have a pre-existing, like a skew, like, okay, TSH is off, so now we can check this. Now we can check this.
A reflux.
Right.
So is when they order the labs, it'll say with reflux, meaning if this is flagged, then
reflex.
Yeah. Reflux or reflex.
Either way, fucking say, I know what you're talking about.
Yeah. It's like, we'll see that, like, I had a friend and we were traveling, and I like love reading labs. And he's like, I got my labs. My doctor said everything was good. And I'm looking at it, his ALT was 53, and like his TSH, his thyroid stimulating hormone, was really low. It was 0.43, and like nothing else was tested. I was like, this is mind blowing to me. So And again, doctors say that that's a whole nother episode. So, okay, so I have one too here from Marina. Can hormonal birth control cause issues, or does it hide pre-existing to taking? Answer
So
for me. Can basically
repeat that.
Like, here's the question: is do you have issues? Can hormonal birth control itself give you issues? Or do you have the issues before and then hormonal birth control is just kind of covering it up?
Okay. That's actually a really interesting question, because I think it's both. I think one, well, because what is outside of outside of like pregnancy protection, what's the main reason that they prescribe birth control? Because you have a fucking issue. You have acne, you have irregular periods, you have pain, you have pelvic pain. So you do have a problem. Like, there's already a problem. And generally what happens is the birth control does kind of mask it at first, because you lose your period and your hormones kind of like go flat, and you might get a temporary effect until obviously it starts creating other problems. But then on the flip side, you might not have anything, and let's say you went on it for pregnancy protection, and it does create a problem. So it's both. It's both, for sure.
I think absolutely what you're saying, 100%. I think that the timeline in which you go on it as well. I think that so like it's this like 14, 15, 16 age that they put kids on kids, because that's the age, right? Like teens on birth control. And it's normally 2-3-ish years after we first get our first cycle, which if you really start to look at like the life cycle of hormones, that's when it's almost kind of like every receptor is getting hit. Things are feeling magnified, and our body is like, it's kind of like, I guess, and this is like kind of a theory, but also like there's data on this. Like men, when you drop more like women's estrogen can go between 50 and 100, and they might not even notice, right?
No.
Whereas a woman's testosterone between 50 and 100, that's going to be a huge difference. Men, vice versa, right? Because of hormonal receptors. So I think as we're starting to like go through puberty a little bit more, and we're kind of like we're finding our hormones and our receptors are getting hit, everything feels a lot harder. Cramps, we haven't had them before, our body's not used to them. Our estrogen levels are starting to come up. They're like regulating, almost like perimenopause. It's kind of like these two ends, right? Things are turning on and turning off. And there's irregularities with periods. The words are really hard. Irregularities. And I think that the first thing is just like, rather than looking deep at what is actually happening with the body, it is addressing those hormones. I think you also eat like shit when you're a teenager and you're drinking. That's
what I was going to say. They're like, hey, I have acne. I'm like, you eat fucking terrible. Your skin's getting oily because your hormones are going up. Your hygiene, you probably isn't that good. You're caking on a shitload of cosmetic products. You're in a fucking school all day that is like literally so much bacteria. Of course you're having acne. Yeah. You don't need fucking birth control for your acne. Oh my God. I just want to smash my head into the table.
And I on the other side, I see if you're taking birth control as a team to prevent pregnancy, it's one thing, and I absolutely get that. And I think it's there for sure.
Sure.
As far as like prevention of pregnancy as a team.
Yeah. Yep.
Yeah. I have a daughter, so I'm always asking myself, like, what would I be doing in this situation? But I've also had friends where their kids began taking birth control for these skin issues. And now we're dealing with gut issues.
Oh, yeah. I guess it's I guess the conversation would come down to like, if it is a pregnancy protection thing, kind of what are our options and what is going to be best. Because, yeah, I mean, that you're going to have a lot of problems having a kid at 16. Like that might be worse than a gut issue. Now,
100%.
But on the flip side of that, there's also the conversation of like, where does that lead us? We start at 15, we keep going till we're 30, 25, whatever. Can we even have kids later? Like, do we accumulate all of these other issues and then we're not fucking fertile? And it's like, so it's a hard conversation.
Another that we didn't even mention yet is like, we haven't even touched on the anxiety, depression, and suicide.
Oh, well, yeah.
That's like a whole nother like,
Yeah.
they like go down, but there's so much correlation between, I mean, like even just something so little in general, right? Like we have progesterone, and then that gets kind of like turned into allopregnanolone, right?
Yep.
Like it works like a GABA inside of the body, which is going to promote well-being and calming and sleep. And when pressing these, making these changes at a very young age, you see this correlation with the rise in anxiety and depression in women specifically who are on birth control. See it in the data. And
yeah,
so
well, yeah, for sure. And you see it just in symptoms being reported. It's pretty often that you would see somebody report at least some type of change in mood with birth control, like most people, I would think.
Yeah. Yeah.
And there's definitely a lot of, sorry, there we go. There's definitely like a lot of interplay with just neurotransmitters in general. Like estrogen has a role in metabolism of serotonin, and GABA is affected. Well, we also know that a lot of birth controls will lower testosterone. With testosterone going down, we normally see dopamine levels drop a lot of the time. So it's like you might be working with nothing at some point. Like you might be working with a really flat like neurotransmitter profile,
Right.
So you're going to end up with, low motivation, low energy, anxiety. It's all these things like all combined together, and at the same time, you don't really know what to do about it because now the next thing that happens is, oh man, this takes you down such a long road too. Because next thing you know, now we have an SSRI prescribed.
Yes. Oh.
Now we have a dopamine agonist prescribed. Now we have, it's like, oh shit. Now we're getting into, so we're just talking about, birth control, coming off, effects of it. That's not even talking about all the other shit that they can start dumping on top of you. I had one of those.
When I have clients, and it's like I'm always like really careful about like saying shit, right? But it's really cool to me when I have a client who decides to come off birth control, and following 2, 3, 4 months, we're also able to bring them off. Not we, meaning me, I'm not a medical doctor, but alongside of their medical professional, they also are able to come off of their antidepressants and feel better off both than they have in years.
Right. Yeah. Yeah. It's a real thing. I mean, it's definitely a common scenario, and gut issues, are kind of the same thing. With gut issues, we'll see a lot of serotonin issues. We'll see a lot of dopamine issues. So, I mean, you definitely see this, this kind of like sequence of events where they have a problem, they get prescribed something for the problem, that creates another problem, they get prescribed something for the next problem.
Yeah.
So on and so forth down the line. So yeah. That's fun. Yeah. Do you ever get these consults and you see birth control, and then you see antidepressants, and you see like ADHD meds, and they're like, I have all these symptoms, and you're just kind of like shaking your head and looking at it. You're like, yep, yep.
I have an intake part, like on my intake, that's like prescriptions that you're currently taking, and very rarely do I just see when there's a birth control option there, just birth control. There's normally that goes along with it.
If they've been on it a while, especially.
Yeah. It's normally like, I guess, like I very rarely get somebody who's like, I'm just trying to lose 10 pounds. I haven't really been dieting. Like normally it's a very long list.
Yeah. I would love just like an overweight client that's really sedentary that eats a lot.
I just got one and
Yes. That's the
and
best.
it's the
That's like
coolest
the best
thing
thing
ever.
ever.
Also, they just spent a year on their mental health. This is the second person around. I'm like, this person's like, I just spent a year on my mental health and I let my physical self go just to work on my mental health. And I'm ready to out again. I'm like really excited.
It's a dream.
Yeah.
It's
It's always, yeah, we'll see once we kind of start digging, you know what I mean? But, so this is another one I got too. Gut issues and HBC. What comes first?
Either or. Yeah. You could certainly have a gut issue that causes something like acne or causes like estrogen dominance. They put you on a birth control, or vice versa. You could definitely be on birth control. We know notoriously birth control will interrupt like motility, causing SIBO, on down the line. So, yeah, in a case like that, I just ask, like, I'm like, did you have a gut issue before you got put on birth control? Did you form it after?
And you'll see this like really cool blend that just like really, how about this blend that's given out really supports our business, and it's doxycycline and hormonal birth control.
Smash it. Let's do like 4 years of doxy.
Yes.
All right. And we want to make sure we use a Mirena for sure, because that's going to be pretty harsh.
Yeah.
And then maybe just throw like an SSRI in there just for good measure.
Yeah, because by then you'll need one because you have 0 neurotransmitters being created in your brain or in your gut. So there's
how much caffeine do you think you're using by then just to sustain like normal function?
Yeah.
Maybe.
Honestly, if you can even do caffeine, because by then your adrenals might even be tanked, that any caffeine just makes you super hypersensitive too.
Maybe like trazodone or like a benzo at night.
Yeah.
Shit. Someone says I'm your client if you want someone who eats a lot.
Yeah.
Yes.
I linked in bio.
It's like I want a pre-screening of all clients. Like if you're not eating at least a certain times over your body weight and haven't been sedentary for like the last 3 months, we can't start. That's the new rule.
Yeah. They're not following you on Instagram.
Yeah, well, yeah. Any more questions?
Gut issues, hormonal. That's it I have on my side. So unless there's anything else in the chat box. Cool.
That's it. I'll check. Let me scroll this real quick, but I think that is it. I like this one. My doc says she doesn't order the labs because regardless of what it says, it wouldn't change the treatment. Okay. That's fantastic. That sounds like malpractice.
Was that on the fertility?
No,
Or just
that's that was Dawn, I think, asking that.
Oh yeah, we've been just.
I can't tell because it's screen names. Yeah.
Yeah. So like I've seen this too, like especially with like endocrine doctors. Like it really just kind of depends on the doctor you have.
Some are really good though.
Some are really good. That's the thing. But in general, I think there's a lot of like gaslighting, you know, where it's like if you have these symptoms and they're not looking at it. It seems to be more with adrenal issues, I feel like, because doctors aren't really looking at that. So they're like kind of like you're just feeling the way you're feeling in your own head.
Yeah.
Can't really see. There's not a medical diagnosis right here, but they're not really looking at things you have like great disease or something along those lines.
Right. Yeah.
Not asking you on your calorie intake and your training.
You're right. Yeah, and it's not like we're not saying that they're all bad. Like I see some that are really awesome and they do a really good job. But I think that the theme would be they probably do their own research.
they seem to be more passionate in general.
Yep.
Out.
It's just like anyone in any field. If you're going to be really good in any field, you probably didn't, gain the majority of your knowledge through a degree, through a certification, through whatever. You probably continued your own education. Like my doctor, he's freaking amazing, but he got, he's gotten he got his MD. Oh God, forever ago, PhD forever ago. So I know that he doesn't. Who knows what they were teaching back then? You know what I mean? Like, so yeah.
I had my gastroenterologist tell me that I'm taking too many vitamins, and that people live. This is literally like people lived a long life and never took vitamins before. He gave me like that whole spiel. I didn't go into him about how much the environment, our food, like everything's changed. I just like let it be. And I think at the time I was taking like omegas, a multivitamin, like not even that much stuff.
Yeah, well, that's not true because life expectancy is way longer than it used to be, but that's fine. Even though it's mostly medication, but still, like,
off where he's like, my blah blah lived to be 100 and they smoked every day, and it's like, okay,
yeah, that's fine, that happens, but that's not the norm, obviously. Other doctors won't order labs until the third miscarriage. Jesus God, that's so bad. I'm not laughing at that, but that's so bad. This one, I showed her my tanked cortisol on the Dutch, and she said, awesome, that means you aren't stressed, LOL.
Is that from Dawn?
Yeah.
Yeah. Flatlined.
That's so good. Yeah. I remember when I got my first Dutch test way back, probably 2014 or 15.
You were flatlined.
It was flat. And Dr. Serrano, my doctor, calls me, and he's Hispanic. I think he's from Dominican Republic or Costa Rica. But he's got a thick accent. But he always cusses me out on the phone. And he gets on the phone. He's like, what the fuck is this? He's like, you fucking see this shit? He's like cussing me out. And he's like, what is wrong? But that was so cool because he basically introduced me to that test way back when Precision Analytics, like the company, was like just coming around. And yeah, so it's pretty cool. That was back before it didn't even have organic acids on it back then. Yeah.
See things even like the Dutch test and also like the GI map continuously look at research and put new things on there based on what they feel is relevant to the things that are needed for diagnostics, Yeah. It's cool. All of a sudden I'll look at the GI map and I'm like, I've never even heard of that before.
Right. Yeah, that's pretty cool.
So like every like it has it. So cool.
Yeah, I think we're good. I appreciate everyone coming on. We appreciate you. We will, once this goes up, it'll give me an option to repost. So I'll repost the video. You can go back and watch everything.
Awesome. Dope. And we'll do another one. We'll find another topic. And if you guys have ideas for topics, slide in the DMs and let us know.
Cats. Can we talk about cats, perhaps? Or like bird watching?
Yeah.
No. Okay.
I would go for cats over bird watching.
Birds are really relaxing.
We don't do that out here. Everyone's just so busy with their politics and rioting that.
Oh God, yeah. Ugh.
And their shots,
I'm in the country. Like it smells like it just smells like cow manure, and there's birds everywhere. It's nice though.
Yeah, we're not there.
All righty. All right. We'll see you all next time.
Bye.